This law will cut costs and make coverage more affordable for families and small businesses. Costs will come down for families, businesses, and the federal government.
My proposal would bring down the cost of health care for millions.
The White House itself has urged those who are getting a bit of sticker shock to shop around.
Huge increases in premium costs for consumers.
These premiums are rising anywhere from 15 to 20% to 25%.
Customers in Oklahoma, they'll see a 36% increase.
I know we got our notices here today, and all it said was costs going up, up, up,
Yep,
and up.
Obamacare's third year of open enrollment just starting. Meanwhile, the Senate's number 4 Republican Wyoming Senator John Barrasso saying insurance premiums are rising, in some instances skyrocketing. And Senator Barrasso also says choices for doctors and plans are shrinking. In Oklahoma, premiums are expected to rise an average of 36%. And in Montana, premiums could rise by nearly 35%. Senator Barrasso says unless something dramatic happens, this could be the year Obamacare collapses. And I want to know what you think. Is your health care service better or worse since Obamacare passed? Tweet better or worse using hashtag Greta, and we're going to show you the live Twitter votes throughout the show. Wyoming Senator John Barrasso is here to go on the record. Good evening, sir.
Thanks for having me. Great to be with you.
You predicting that this could be the year that Obamacare collapses, is that right?
Well, I think it's heading in that direction.
What does that mean? What happens when it collapses?
Well, the prices continue to go up, and they've gone up hugely, and the copay has gone up to the out-of-pocket, so people are deciding this isn't a good deal for me. I'm against it. So even the Secretary of Health and Human Services says we're not expecting the kind of sign-ups this year, now that they've opened the exchange, that they were talking about before. They said they'd sign up 20 million people this year. They'll be lucky to get half of that number.
All right. How many people are uninsured? Do you have any idea?
There are over 32 million people still uninsured, and so many of those that did get insurance under the Obama health care law ended up on Medicaid, which is a program we know doesn't work well. Much harder for people on Medicaid because it pays doctors and hospitals so little, harder for them to actually get in to get an appointment to see a doctor.
Okay, so as costs go up, fewer people sign up because it's gotten more expensive, and then the pool of those actually participating are older and sicker, and because they're older and sicker, the premiums go up, and then the costs now are up again. And of course, the copay is getting much more expensive. So tell me, where is this headed for everybody?
Well, fewer of the young, healthy people sign up. The prices are continuing to go up, and that's what we're going to see. Choices are going to go down. The only way insurance companies can try to keep the prices in a narrow range is to say you can go to fewer hospitals, fewer doctors, which is why the Obama administration is now saying if you want to find insurance, you better shop around, which means you have to get rid of what you had from last year, which may mean you also lost your doctor and your hospital.
All right, so are you suggesting a year from now the uninsured will be how many?
Well, I expect it's not going to be any lower than 30 million. There's still going to be over 30 million Americans uninsured. And, as a Republican, as a doctor, I just want to make sure we have more people who are getting, better care at better costs. And you know what the president promised. People haven't seen that.
All right, so the cost, look, the president's wrong. The costs have gone up. He's dead wrong on that. I got you. Don't get to keep your doctor. The president's dead wrong on that. Not everybody gets to keep his doctor. So tell me, what are you going to do about it?
Well, I want to get a Republican president elected. You just had Marco Rubio on. Every one of these Republican candidates has a plan that they're promoting. Of course, I've always been promoting the State Health Care Choice Act. So if California and New York want to keep what they have and keep the mandates, let them. But for me and for Wyoming, for Texas, other states, we ought to have the states making those decisions, eliminate the mandates, the individual mandate, the employer mandate, the mandate you have to buy insurance that President Obama says you need, rather than what you know is best for you and your family.
Well, it certainly is disturbing. These rising costs are going up. I mean, I've looked at the list, and it's disturbing. I feel, a lot of people are going to be hurting.
Half the co-ops have failed, and now 800,000 people have just been pushed off of those. They're scrambling now to find insurance. 200,000 in New York, and they're shutting it down by the end of this month because it's on such unstable ground. Yeah.
Anyway, Senator, thank you, sir.
Thanks for having me.